My name is Jared, and I'm the developer of RT Tutor. This is a YouTube channel where I'm going to be providing you information related to the respiratory system, respiratory therapy, and healthcare in general. So, since we're going to be focusing on respiratory, this is going to be the launch video. So what do we want to talk about first is what is a respiratory therapist? So the respiratory therapist is a specialist that works with the respiratory and cardiopulmonary system, and they work with patients to prevent, identify, treat acute and chronic respiratory illnesses, and they provide patient education. And this education is usually disease specific to respiratory, so they'll be teaching patients with COPD about how to manage their disease, or patients with asthma, how to take their medications, how to manage their disease, or somebody that requires a ventilator at home, they're going to be teaching them how to take care of themselves at home and work with that machine. So where are the respiratory therapists found? Most respiratory therapists work in acute care hospitals. So they work in the intensive care units, running ventilators, giving medications to critically ill patients. They also can work in diagnostic labs. They're performing mainly lung tests on people to tell how well their lungs are functioning or how poorly their lungs are functioning, how well they're responding to their medications, their care plans, and disease-specific related things. They can work in sleep centers, in which they diagnose sleep apnea mainly. And they can work in rehabilitation centers, long-term centers, skilled nursing centers. These are with patients with significant disabilities that require 24-hour care, or maybe they're on a ventilator all the time, or they have what's called a tracheostomy, and they need a specialist to help take care of these patients. They also can work in home care for the patients that are able to go home with these tracheostomies or ventilators, or if they're diagnosed with sleep apnea, if they have a sleep apnea machine, they can go home and help these patients. Some of them also work in patient transport, so they're transporting very critical patients that mainly require what's called mechanical ventilation, so they need help breathing because they're so sick they can't do it on their own anymore. A few might work in wellness centers, and a couple more work in medical device companies. So they're the companies that work to do research or to develop new machines or treatments and ventilators and all that good stuff. And some of them also can work as teaching. So we're going to start with how does one become a respiratory therapist. So if you're watching this video, you're either a patient, you might be somebody who's thinking about what they want to go to school for, or they're just, curious about what this guy running around in the blue scrubs is at the hospital. So a respiratory therapist, to become one, the minimum requirement is you have to get an associate degree from a school that is accredited by what's called COARC, and this is the Commission on Accreditation for Respiratory Therapy, or Respiratory Care. And these are the guys that come in and say, your school provides the minimum education required for us to allow you to go out and work with patients in the real world. So most of these programs are associate degree based. Some of them, when you graduate, they're actually bachelor's degree programs, and even other schools offer what's called a bachelor's degree completion program. So for these programs, you have your associate degree, you're licensed, you're working, and you're taking extra credits to show you care about your education, and this is coming very popular since the American Association of Respiratory Care recently said that their big initiative for 2020 is that all of their respiratory therapists in the United States should have a bachelor's degree to practice. So we're going to be hearing a lot about that in the near future. And there are some master's degree programs out there, but most of them are management type degrees, and they don't really focus on any type of advanced practice. So respiratory therapy school, you can take this at a community college, you can take it at a university, trade schools. Some programs are offered through a joint program through hospital systems, and you're going to be taking classroom work. You got to get in the classroom and learn the basics before you can work with patients. You're going to be doing some lab skills, so you're going to be playing with machines when they're hooked up to test patients or test lungs and learning how they work and getting to play with them a little bit and just understand the equipment. And you're going to be having clinical experiences, so you're going to get in the hospitals and you're going to work with patients. So these are the general type classes that you'll be taking. First is you're going to take human anatomy and physiology. If you're going to work in healthcare, you got to take A and P. There's no getting around it. You have to prove that you know the basics about the human body to be able to provide healthcare. Some of your respiratory classes are going to get very in-depth about respiratory and cardiopulmonary physiology and pathophysiology. So you're going to learn about how the heart and how the lungs work together and how diseases can affect this process. So you're going to be taking microbiology because this is where diseases come from. You need to learn about the cells, you need to learn about the genetics. There's a couple genetic related or genetic based respiratory diseases out there like cystic fibrosis that you'll learn about eventually. You need to learn about how diseases are transmitted and how to prevent these diseases from being transmitted. You're going to need to learn how to sterilize things because a lot of the respiratory equipment is reusable, so you need to know how to clean it effectively. You're going to need to learn about immunology, which is about how your immunoglobulins work in your body and how allergies work. You're going to be taking chemistry classes because you got to take your chemistry. You're going to learn a little bit about elements. The big one is the O, oxygen. You're also going to learn about some chemicals, ions, solutions, and what's called the acid-base theory, which once you get into respiratory specific classes, you'll understand why that's so important. You got to take math. There's no getting around it. If you work in healthcare, you need to know math, which is mainly basic algebra. And physics is a very heavy part of respiratory therapy. You need to learn about fluid and gas behavior. A lot of respiratory therapy is related to what's called fluid dynamics. You're also going to need to know about some kinetic theories of matter, and you're going to learn a ton about P and T, which is pressure and temperature. And we'll get into that more, why it's so important to learn about your P's and T's a little bit later. So your classroom instruction is you're going to learn the basics, and then you're going to learn the advanced concepts of respiratory therapy. So you're going to learn about all of these machines and how they work with the patients to make them better. You're going to learn how to do cardiopulmonary diagnostic testing with big machines, with little machines, at the bedside, in the lab, through numerous settings. You're also going to learn about how to take care of patients in the critical care setting. You're going to learn about heart rate monitors, EKGs, blood gas monitors, or what's called point of care testing type monitors. You're going to learn at least a little bit about neonatal and pediatric concepts because respiratory therapy plays a very important part in resuscitating newborns and taking care of pediatric diseases. And you're going to learn about equipment. And you can see this picture. There's a lot of scary equipment there, but if you're a respiratory therapist, you can at least identify a couple of them on there that you still use, and I know some of those are outdated and probably aren't even manufactured anymore, but after you get through your school, you're going to understand what all of these pieces of equipment are, and you're going to learn to love some of them and hate an awful lot of them. So the laboratory, this is where you're going to get your hands-on practice with equipment, and you're going to be practicing stuff that you're going to be using every day when you go to work. And so you can see there's that little old lady there on the ventilator. That's kind of what you're going to be doing, is taking care of these patients while they're in bed, while they're hooked up to the breathing machine. Yeah. And moving right along. So your clinical experiences, these are when you're going to get into the hospital and actually work with patients, taking care of them, and learning more about how to be a respiratory therapist. So you're not working with your own license per se, but you are working under somebody else's license. So you have what's called a preceptor who's going to be supervising you very closely while you're in the hospital and making sure that you're practicing safely. This is a lot like on-the-job training, so that you're going out and you're doing the stuff that you'd be doing if you were working as a respiratory therapist. You're just getting a little extra monitoring and attention. And in this setting, you're going to be doing your patient assessments. You're going to be putting your stethoscope on the patient. You're going to be listening to their lungs. You're going to be observing how these patients act and how their conditions change over time. You're going to be understanding how to modify treatments and therapies. You're going to be learning how to document patient responses in the patient record or electronic medical records, which they're all turning into. And you're going to learn how to collect some samples. And another big thing you're going to be learning about is how to communicate with the rest of the healthcare team. So you're going to be learning how to talk to your doctors, your nurses, your pharmacists, the roles that each of these people play. and how they all work together fairly smoothly most of the time to take care of patients. So the bachelor's degree level classes. So these are after you learn the basics, so you know how the lungs work, you know how a lot of the equipment work, but you need a couple advanced concepts. So you're going to be learning about research. You're going to have a class in your research. You got to learn how to critically approve research papers that are published to tell if they're applicable to your practice or if they're not really good enough to be converted into clinical practice. You're going to learn how to provide education and teaching, and this might be the teaching that you provide to your patients. It might be teaching in the school setting, so you can be an instructor of a respiratory program. It's also going to be focusing on management, so you're going to learn how to be a manager or a supervisor of a respiratory or healthcare department. And you're going to be taking classes in ethics, because a lot of what respiratory works with is related closely to bioethics, because the patients that are cared for by respiratory therapists in the critical care setting are very, very sick, and a lot of the times they do die. So you need to understand the ethics of that situation, what's right, what's wrong, how to deal with it, and how to take care of yourself when these situations arrive. You're also going to be learning about how to write for healthcare professionals. So this is in case you want to get into research and you want to start publishing your research. You got to learn how to properly cite your work. You got to learn how to conduct your research and how to do what's called disseminate your research, or publish it and get it out there so others can learn from you. So there are a couple schools that offer a master's degree in respiratory therapy. Unfortunately, these are only offered as healthcare administrator, manager, or educator type degrees. A lot of people have been begging for what's called an advanced practice RT, and this is very similar to the neonatal or the nurse practitioner degree, but it's been very difficult to make any progress towards this, and a lot of it's related to politics, difficulties in licensure, state problems, because what they're searching to do is essentially create a healthcare profession that isn't around yet. So you can imagine a lot of people, with the current way healthcare is set up, is it's very difficult to make a healthcare profession when it comes to reimbursing or paying and safety and everything else like that. And with the way healthcare is in America right now, it's a little rocky, so it's very difficult to get respiratory therapy to the advanced practice level. But hopefully in the future it will happen, but who knows if it'll happen in my lifetime or the next. So how do you get your respiratory license? So after you graduate, you're going to do what's called sit for board, and this means you're basically going to go in and you're going to take an exam. So this exam is offered by what's called the National Board for Respiratory Care, or the NBRC. And they offer a couple examinations that you need to pass in order to get a license to go ahead and work. So the exam you take now is called the Therapist Multiple Choice Exam, or the TCM. It previously was offered as two separate exams, but now it is one. And this will give you your Certified Respiratory Therapist examination and your Registered Respiratory Therapist examination. You also can take other exams related to your specialty practice, and these tests are managed by a company called Applied Measurements Professionals Incorporated, or AMP, and they are actually conducted at H&R Block centers. So if you're taking your exams during tax season, it's going to be a little noisy and a little busy, but the rest of the year it's usually pretty quiet at those centers. And after you pass these exams, you put in an application with your state that you want to practice with. They contact the respiratory board, and the respiratory board tells them, "Oh yeah, Jim passed his exam. He's ready to get that license and work." And they say, "You got it," and they mail you back your approval and a number, and you're ready to get out in the workforce. So the CRT credential. So this is the entry level examination. So this is 160 questions, and you're scored on 140 of them, and 20 of them are there for practice, and these are pre-test items. So these test questions are ones that they might want to use in the future, but they want to make sure that the students taking the examination understand the question, that there are not any problems with them, that the questions aren't confusing. So it's kind of their way of researching future questions. So you have 3 hours to take this exam. And this exam is going to cover things like patient data and evaluation, how to make recommendations, how to troubleshoot equipment, quality controlling equipment, infection control, and when to start and change therapies. You're going to get a lot of basic information or questions on this examination. And when you take this examination, you're going to get